Hi, I'm Jeff Faber, Employee Benefits Chief Strategy Officer. I'm here to welcome you to Ready for Tomorrow, a Hub International virtual summit. Today's session will be how to support your U.S. workforce in this new normal with personalized benefits. During this half-an-hour session, you'll better understand your employees' benefits priorities, how they've changed, and maybe where to refocus. Also understand what do employees value more or less than they did before. And then lastly, we'll cover the three types of employers that we see assisting them in how to return to work. We need to understand how benefits have changed and how priorities and expectations have changed within your workforce. A good, strong, robust benefits program is a portfolio that meets people where they live at every stage in their career. So we use our analytics platform to essentially walk a mile in every person's shoes to understand their individual needs. We know that the value proposition for benefits is going to be different, whether that person is a high-paid executive or a low-paid new hire. We need to understand how to change the discussion to be about people and culture and not necessarily insurance products as a priority. When we prioritize insurance products, it becomes a product push and a sale. When we focus on people and culture and how insurance products can potentially fit, these benefits are better received, and people will ultimately gravitate themselves toward the benefit that best fits. The only metrics that we think that really count are health, wealth, and time. So if we can put everything in those terms when we communicate to employees, if it will make you healthier, give you access to choice that will allow you to be healthier, whether it will save you money in terms of discounts, both near-term and maybe long-term savings, or save you time, be less of a headache than it was before. These are the metrics I think that count moving forward. Then lastly, we know that COVID has placed a lot of restrictions on our businesses, that return to work isn't necessarily a light switch that flips on and off, but rather a dimmer switch that can be dialed up and dialed back. We have to start thinking about benefits in that way as well, that these benefits can be dialed up and dialed back to certain levels, regardless of whether it's a good fit with an employee or a good time for that employee. And then also to dial it up and dial it back based on your budgetary constraints and restrictions. When we think about priorities for benefits back in January, they were very different than they are now. We know that the pendulum shifts and swings both toward from back in January, where priorities were mainly about my career path and whether the stock market was going to continue to go up and up and up, and career coaching and team building, toward more near-term focuses on, is my family healthy and safe? Are we at home, hunkered down, sheltered in place? And we've gotten a lot more basic in our immediate understandings and priorities. By prioritizing things like food, toilet paper, reliable Wi-Fi for the first few weeks of this pandemic, we know that that pendulum will quickly shift back and overcorrect like markets often do, so that sooner or later your employees will have a expectation for what was old back in late 2019 and early 2020. Things like medical enhancement, long-term incentive compensation, flexible work schedules, recognition programs, and volunteer days. Those will be a focus at some point, hopefully soon. But we know that when markets correct, they correct at different times and different time frames. And they correct, expectations change within employee sets very differently based on where they live and where they work and their stage in their career. We use our analytics platform to create an overall view of your cultural profile. And so this is one example of how we've plotted everything out within your workforce. Your cultural workforce is broken up into these employee cultures that each have a different priority and a different expectation for the benefits. Along the top are years of service. Along the different individual rows are approximate ages. And so that first column of data that you see are the four types of people that you can hire within a current year. They range from the new entrant, that fresh face that really has no understanding of benefits other than do you offer them, and yes or no, to that late stage hire that has a really deft understanding of potentially long-term disability requirements, retirement benefits, vesting schedules. They want to understand ease of use, and everybody in between. Technical hires are typically coming from somewhere else with a technical set of skills, a unique set of skills that they're bringing from somewhere else. This is probably their first or second comparative opportunity to compare the benefits that you're offering today versus the benefits that they had at their prior employer. As they go through life and they acquire assets like minivans, spouses, and children, their buying needs change, their expectations change. They focus more on medical and potentially toward long-term savings vehicles and retirement. So these technical hires are going to be comparing your benefits with someone else's and have a better engagement status and more willing to engage in benefits because they know how they work. The mid-career hires are coming from somewhere else as well. And not only do they have the technical skills, but they've also acquired managerial or leadership skills. And so these are people who are coming at a slightly different part of their career. Maybe their children are a little bit older. Maybe they have different expectations for where this career, this job is going to take them. And often their family concerns are going to trump certain aspects of their engagement. They're more likely to take off early to go see a children's soccer game. And they're more likely to be put a monetary value on the benefits that they used to have versus the ones that they might be having at your employer. And if there is a significant gap, they'd often solve that gap in negotiation by adding $1,000 to $5,000 more to their base salary request. These are the four types of employees that we can bring in during a year. And as you can see, they have very unique and different expectations for benefits, different priorities for it as well. As we move through that first year and as those employees transition into our core workforce, it's really made up of three groups. At the top corner, we've got transitional workers. These are your formerly fresh faces and your former technical hires that are moving into a different aspect of their career and learning other aspects of the function that you provide them at the employment. Ultimately, a transitional worker is somebody that might be learning a new skill. So while they were a call center employee for the first year or two, now perhaps they're managing other call center employees. Our focus there is management training, creating a career path, and really driving home the idea that the development is lifelong. And our total comp philosophy becomes much more apparent with those transitional workers. They typically have a high engagement rate because as an employer, we're willing to invest in them and grow their career, and they're willing to invest in us because they see the career path and the growth and the trajectory. At the bottom right corner are founders, and these founders might describe themselves as employee number 17, or I remember when this office was only this big. They're ultimately your culture builders, the fire keepers for your original culture. And they understand that while they're later stage in their career and thinking now about retirement readiness, they're also trying to figure out how to create a legacy and maybe a succession plan a little bit further down the line. These people have very different expectations than potentially your transitional workers or your new entrants. And then stuck in the middle is a place where we often find all of ourselves, is this forgotten middle. We're not necessarily the new employee, nor are we employee number 17. This is where most populations end up, and it's a place that is a cultural anchor for good or for bad. And so our challenge, especially now, is better understanding the needs of this forgotten middle and how to foster a culture that is positive and proactive and effective in creating productivity for the population. This is where our medical cost drivers also are in transition. And this is where a lot of our opportunity exists as benefits professionals to be able to create a portfolio that speaks to and re-engages this forgotten middle. Because at their point in their life and at their point in their career, they typically have a lower engagement than the other clusters of population that we see. When we look at that data and we start to overlay other information that we know, like U.S. Census Tract data and Hub's proprietary databases, we can find distinct buying behaviors and buying personas within the population, distinct behaviors that differentiate a person from another person, not necessarily based on age or on service, but based on where they live, how much they make, and what they're enrolled in. And so we can take our U.S. Census Tract data and overlay it and understand the difference between how far $100,000 gets you in Manhattan, New York versus Manhattan, Kansas. And some of the buying behaviors in these personas that have revealed themselves are very simple and easy for us to understand. But again, by walking a mile in every one of these shoes and creating a benefits portfolio that speaks to each one of these individual people, we really need to better understand the people in our demographics and how best to handle them. So one of those key demographics is the financially fragile. 78% of the U.S. population surveyed last year was within 2 months of not having an income to being maxed out on their credit cards and bankrupt. And we know that 78% is probably a low number compared to where we are today with our unemployment rate. This 78% might think of $20 not necessarily as a $20 bill, but as a bag of groceries, or the difference between making a payment on their electric bill for that month. And so what we try to do is highlight for our customers and help them understand how much of their potential population is financially fragile and what percentage of their take-home checks they're spending on employee contributions. Other groups include single-income households. So 39% of U.S. households are single-income households, and they're worried more about consistency in benefits and whether spouses are covered at or about the same level that they're covered. They're also thinking through all the different aspects of long-term savings vehicles to protect themselves and the security of their families. Single parents have much the same consideration as single-income households, but they have the added complexity of being parents and understanding that emergency childcare and flexible work hours are probably more valuable to them than other benefits we might offer. Then lastly, 1 out of 6 U.S. households is an empty nester population. These are people that either their children are in late stage of high school, preparing for college, they're in college, or they've soon thereafter graduated from college. And they have a different understanding about the benefits that they think about at this part of their life cycle. They want to understand more about long-term disability, long-term care, adult care for maybe their aging parents. They might be considering how to downsize their home or whether their 401k is really ready for retirement. So very different understandings for these personas and buying habits. And I think that when we look at our data and we look at the changing data from what you had a year ago to what you have maybe today after the effect of furloughs and layoffs, your population could be very different. And maybe your benefits need to be different to custom cater to those populations. Another advancement that we've made in our analytics is also to look at food deserts. And food deserts are places where there's no bona fide grocery store available to somebody. Whether they have access to a car is a huge consideration, or access to public transportation, or if they live in a rural area and are outside of 20 miles from a bona fide grocery store. We know that employees who don't have access to these grocery stores don't have the necessary fuel to fuel their body and are more prone to acute and chronic care concerns and medical issues. And I think what's important here is for us to understand, of the percentage of the population that we have that are financially fragile, how many live in a food desert, and what are the ways that we could potentially solve that issue so that you can solve healthcare on the front end about what you put into the machine and not necessarily on the back end on how you fix the machine. Another consideration that we make is to look at employee contributions as a fixed expense layered on with rent. And so for employees that primarily rent, we know zip code by zip code, census tract by census tract, what the average rent is in those areas. And so we can give you an understanding and an estimate of the potential fixed costs that are coming out of every employee's paycheck, not only in their employee contributions, but also potential rent. This gives us a further sense of maybe how financially fragile and how much variable income these employees truly have. Lastly, all those demographics overlay into considerations around how we structure benefit programs. And you see a sample client here that has 4 plans, plans A through D. Each plan distinctly talks to a different part of their population. From Plan D that appeals to their founder class, who make significantly more money than the other groups. They're also significantly older and have a higher demographic factor or inherent risk in the benefits plan option compared to the other plans and the other programs. And so ultimately, what we really want to understand is how the differences between Plan A, Plan B, Plan C, and D are custom curated to those individual people to provide that new hire choice, that new family choice, and that founder class some choice. And at the end of the day, we really want to understand as well that we've set appropriately and allocated costs and risks commensurate with the underlying demographic concerns of each of the plans. Make sure that people are paying a fair price and that they feel that they're continuing to derive value from those. Over the last few months, we've seen a significant increase in the stress levels around my long-term disability program. And people are, for the first time, probably more so in the last 6 weeks than probably the prior 5 years, really wondering and concerned about what happens if I'm on long-term disability. And one of the other offshoots of our analysis looks at potential gaps that we can solve. And we can solve these gaps a variety of ways. One, we can help employers figure out how much it costs to raise certain levels within certain classes of the organization around short-term and long-term disability programs. Another is that we can create voluntary buy-up offerings that allow employees to solve the gaps themselves. And then lastly, we can provide individual disability products that might solve those needs for some of the higher compensated people within your population. Ultimately, it's top of mind, especially as that pendulum has swung more toward physiology and safety and health. But we know eventually it'll probably swing back toward more of the softer skills and softer benefits. And as it swings more toward these softer benefits, we are very concerned at some point about providing access to benefits that may save money out of an employee's pocket. These don't necessarily cost employers anything, just the administrative lift of getting some of these benefits up and running and communicated properly. Items like pet insurance or auto, home, and renters. If an employee could save $600 to $1,200 a year by finding a better deal on their auto and home and renters through their employer, there's cachet and value in that. There's satisfaction derived from finding it through their employer. But then there's also $600 or $1,200 back in their pockets in their paychecks. And so those are benefits that we're starting to see more and more of as we move that pendulum back toward this new normal and trying to really save employees money as they're more focused on liquidity and savings and their ongoing debt load. And when we talk about debt, college debt refinancing and 529s are certainly an issue. And over the past 4 or 5 years, we've seen a big push around college debt as it's become more and more central into the nation's consciousness. But then also 529s as well. We know that 1 out of 6 households is an empty nester, but even more of a potential population are folks with young families thinking about how are we going to afford or pay for college to provide that opportunity for our children. And so these are easy benefits for an employer to plug in because they don't really cost them much more than potentially time. And so that's one thing that we're considering and one thing that we're helping a lot of our clients and customers with in the near-term future. When we think about three types of employers returning to work, they largely fall into these categories. Obviously, different situations, whether blue collar, white collar, or gray collar, whether they're consumer-centric, consumer-facing like retail and hospitality, or tech or stock trading. Very different industries have been impacted differently with this pandemic. The hardest hit are the group on the left that have considered over the past few months furloughs and layoffs and potentially executed layoffs and furloughs within their population. We know that the first few weeks of this pandemic, they were racing toward liquidity, drawing down credit lines and trying to grab as much cash as possible to basically weather the storm of no income and no revenue for the next few weeks to months. They have very different questions that they're considering. They're thinking through recovery and return and how quickly can they restore their workforce and in what phases, and in what parts of the country can they come back faster, or do they even want to? Will it look different? And do they want their customer-facing aspect to be different? I think we're all familiar with wearing masks out in public, the tape on sidewalks and in checkout lines for social distancing, the restrictions around restaurants around capacity, 25%, 50% capacity limits. And so for those restaurant customers, those hospitality, those consumer goods customers, we think through all of those aspects too in a reconsideration of their workforce. And then lastly, one of the big items that our customers are thinking in this space is, do they have the administrative bandwidth to be able to hire back maybe 75% of the population that they furloughed? And what does it take from a technology standpoint to recruit and hire 75% of that workforce back? What does it take to help them better understand that we have to be able to recruit and interview virtually and then onboard people without maybe a face-to-face interaction? Very different concerns than that middle group, the paused group, where they're going to tough it out and stay the course. Assessing damage and helping them understand all the changes that they've made in the past few weeks to their workforce have been all in an effort to make sure that they can endure these remaining phases, and helping them understand that the workforce is changing, and in the next few months, the talent may shift so that the pipeline will shift, so that employees that come in to their workforce may be very different from the employees that they hired before. These employers need to understand that they need to create a pipeline that will replace those that will leave. And then lastly, the poised group. This is groups in certain parts of the industry that are poised for aggressive growth, and they're going to seize opportunities to market. They might shift their retooling of their workforce a little bit differently and consider employees that might not live within 15, 20 minutes of the office, but might be more comfortable with getting that top talent person elsewhere who can work virtually and remotely. When we think about people, strategies, processes, and technologies, we want to make sure that they're aligned. So when you consider an employer that has maybe laid off or furloughed 75% of their workforce, and now they're ready to be back in business, an alignment here between people, processes, and technology is key. So we have to ask common questions around our populations. One, around people. So we have an opportunity to survey staff and ask them, how do we build satisfaction? How do we build satisfaction within the population? And what can be applied to our learnings and what we've actually learned over the past few weeks to months to better understand, how can we direct benefits and direct the course of business toward these people specifically? And how can we custom curate a portfolio of offerings that speaks to those people in this new normal? Items like health and performance and wellness and financial wellness to support families. We can use an opportunity to ask employees what they need versus what they want. Now is the better time to understand what benefits are adjustable versus negotiable. Things like ID theft or employee assistance programs, financial wellness things again. We can build processes now to better understand these people, to better maybe reframe performance reviews ongoing, to look at mental health as a core component of our resilience and our ability to be productive employees. And then maybe rethink certain aspects around personal time off and a benefit, especially as we're working virtually or remotely. Then lastly, we need the glue to hold it all together. And that glue is a robust communications plan with the backbone of technology. Many of our customers have shifted to remote and virtual, which means that remote learning and remote onboarding are more and more of a focus. We know that this open enrollment is going to be unlike any other, that a virtual paperless environment is probably the preferred method for many of our customers. And to think about, do we have the technology in place to be able to enroll and manage those employees in a different way? Training for managers on being able to manage people in a remote environment is very different from being able to sit down at their desks and do one-on-ones. And so helping us understand all of those things brings us to a to-do list as an employer. The to-do list obviously is to look back and to look at our current condition and to attempt from a benefits perspective to repair and restore some of the benefits promises that we've changed or shifted over the past few months. Obviously, our key focus and our employer's key focus is to establish health and safety protocols that allow employees to come back and safely work within an organization without fear of potential contamination or infection. But I think it's the time where our companies need to really commit to company culture again and to redraw a new pact or new compact with each of its employees. And so for those customers and those employers that have shifted promises around raises, bonuses, merit, 401k contributions, mid-year plan changes for the medical, it's that time to restore some of those promises or to create a timeline by which we would reconsider some of those earlier changes. And then proactively think about charting a new course. So employers who look at the way they did business and get feedback through survey, through conversation with each of their employees about work practices and what expenses could or could not be cut or revalued, as well as looking at retiree and succession planning, especially with some of the market chaos that's gone on, and look at the population that they have today versus the population they had 3 months ago, how they've shifted, helps us strategically chart this new course. We know that office space is going to be a concern. The commercial real estate market is certainly headed forward for some tougher times over the next 2 to 3 years. But then also in potentially the next 4 to 6 months, when some employers are on hiring freezes and other employers are seizing that opportunity, evolving your talent base and helping better understand in this freezing and melting and refreezing stanza of talent mayhem, how do you get talent in-house? How do you evolve that talent through increased training and onboarding? And then lastly, we know that new benefits are taking a center stage. Telehealth has been a savior for us over the past few months and really has removed a lot of the stigma it had before. It's viable, it's useful, it's on demand, it's cheaper than potentially other alternatives. And that we feel that telehealth is here to stay and probably here to get even bigger and more integral into your benefits platform and package. Items like disability and cybersecurity are also key concerns. So as we create, as we look back and reflect on where we were and our workforce then, and as we assess maybe the damage to our population and our demographics over the past few months, and as we start charting a new course forward, we really want to think about how benefits can be curated to meet every employee where they live and to satisfy the needs of every one of those employees at their certain part of their career. So I want to thank you for joining us today during this session. And thank you for committing and investing some time in enjoying other sessions today as well. We hope that this summit, this virtual summit, is useful for you, and we look forward to working with you. Thank you.